Hi, thank you so much, and welcome. I'm Sarit. I'm one of the midwives at Baystate, Franklin, and Greenfield at Pioneer Women's Health. Here to talk all things Waterbirth. I'm actually presenting from one of our three tub rooms. This is actually our jacuzzi room, which is not totally representative of the rooms we would use if we're expecting to give birth in the tub. We use this more for labor, mostly because we're actually expecting a couple of people coming in. So I was like, I'm not going to accidentally block someone from having a water birth during my water birth talk. So, but I did want to at least show people a little bit, and maybe we'll have time for a little bit of a more of a tour at the end. I've been in practice for about 11 years, and for 9 of those years, I've been providing water birth. And I myself have also given birth in the water twice. It's a big passion of mine, and I'm really so grateful to be able to offer water birth, and I'm really happy to be able to talk about it. I feel like I could talk about it off the cuff for about an hour, but I do have slides. So just to get into a couple of the definitions, some of the terms that I would be using. When I say water birth, I'm sort of referring to a birth in which the infant emerges submerged in a pool of water. We also say hydrotherapy, and that would be the use of water in labor, which can mean a lot of different things. So here are there's a non-exhaustive list of all of the uses I could think of for water during birth. We definitely have people laboring in the shower. That can be really helpful and really soothing. We sometimes have people labor in the tub and get out to give birth to the baby, either by their choice or by our recommendation. Happens all the time, but we still feel like the tub is really, really helpful in those situations. Of course, there's traditional water birth, which would be that the part of the labor and the birth occur in the tub. And then we use water in other circumstances as well. It can be really powerful. Just for pain relief, we use warm and cold compresses. Actually, warm compresses have been shown alone to help decrease perineal tearing and help decrease pain from the stretching of the birth of the baby's head. So even just applying a warm washcloth as the baby's emerging have true medical evidence to support its benefits in labor. So we try and use that as well. If for some reason we can't get in the tub, certainly with epidural, I use that all the time. Sort of lesser known technique for using water in labor would be sterile water papules. This is kind of like a magic trick for the nervous system. Basically, we can inject 4 really tiny bits of water into these pressure points in a person's back. It creates really, really brief stinging pain at the very, very surface. And then it kind of blocks the deeper pain, usually for about an hour or two. This is really commonly used for back labor. It can really help relieve some of that. It's totally different than an epidural. I know it sort of sounds similar in that we're injecting something into your back, but it actually contains no medication. It's pure water. And it's a kind of cool technique in a way that we can use water as well. And then we do often have people just take a postpartum soak right here in this jacuzzi. And it can be just kind of a nice way to have a little self-care. So people who, let's say, have an epidural or for whatever reason didn't give birth in the tub, but just kind of want to take a little time to themselves, a little relaxation. We totally have people just kind of take a nice postpartum bath for relaxation. So I'm a huge fan of water in sort of many different parts of the birth process. I would actually encourage even someone who has zero interest whatsoever in actually giving birth in a tub to seek out a birthing place where water birth is available. Think of tubs as kind of being a litmus test for respectful care in an individual choice in where you're giving birth. Because the presence of tubs really sort of shows you that there is support for natural birth. There's forms of alternative pain relief available. So sometimes people plan a water birth, get in the tub for 10 minutes and decide they hate it, but may use many of the other tools that we have available. So we have balls and bars and sort of ways to help people squat, stools, just a lot of different positioning techniques. And I would just sort of seek Waterbirth out because it kind of is a signal of really respect for individual birthing choices. It actually takes a huge amount of culture from the institution and protocol and staff training and even architecture in order to have a place where Waterbirth exists. So it's in my opinion, just a really a great measure of an institution and sort of a good signal to you that that you and your baby's autonomy and birthing experience would be respected. And I think anytime we have people birthing in the tub, it's way more challenging for the delivering providers to ergonomically support Waterbirth. And that's really how it should be. Most birthing positions actually were developed for our comfort. So when you see in movies, people giving birth on their backs with their feet in the air in stirrups, that has nothing to do with the easiest way for the baby to come out. And it really has to do with just what the doctors found to be the most comfortable. They'd be sitting on a stool, nice and comfy for them, with the baby coming sort of right at them at eye level, and really no thought to the birthing person's comfort. So having a water birth kind of flips that on the head. It's all about the birthing person's comfort, and really actually makes it a little bit harder for the delivering provider to even get close to the birthing person, which may actually have some benefits and provide an additional level of safety to the birthing person. And I will get into that soon. So we get tons of people who come to us and plan a water birth and eventually end up with an epidural or eventually end up with a C-section. Obviously, we wish every water birth was going to be successful, but I guess I feel like if that is the path of the labor, there is some power and some comfort in sort of knowing that you tried everything and that you had every option at your disposal. So even in cases where the water birth is unsuccessful, I would still kind of consider it really a great option and sort of a reassuring sort of experience for most people. So this slide is a little bit meaty. It kind of gets into the hows of water birth. And obviously, feel free to dive in with any questions. It's kind of a magic trick of how does water birth work? Why doesn't the baby drown? Basically, if you can imagine your baby like a little scuba diver, the placenta is like the oxygen tank. And as long as the baby is connected through the umbilical cord to the oxygen tank, they have what they need. And we think that the duration of the flow after the birth is about 4.5 minutes, could be up to 10. But generally when the baby is born in the water, we bring them up to the surface typically within just a couple seconds. And so a baby in the uterus, they're getting the oxygen, the nutrients, everything they need from the placenta through the umbilical cord, and a baby in the tub still getting all of those things. And then eventually getting the stimulation to breathe really from the exposure to the air temperature and to that change in temperature. So typically water birth babies don't breathe underwater until they come up for air. And all really healthy full-term babies are doing some practice breathing movements while they're in your uterus. That's actually a marker for fetal well-being that we do look for when we're assessing babies using ultrasounds. So they're building their breathing muscles. They are swallowing amniotic fluid all the time. A baby swallowing a mouthful of water, while it wouldn't be ideal for them, they should be drinking breast milk most of the time, would not represent a major medical problem to them. So even if they got one swallow or so of water on their way out, they probably would be just fine. But generally in water birth, the babies are not staying under for any time longer than any healthy baby would be able to be underwater, just seconds really. And then just to kind of add to that, all babies take up to a minute to transition. That's sort of considered normal physiology. We don't expect that instantly they're pink and instantly they're crying. That's why APGAR scores are typically assigned as a 1 minute APGAR, not a 0 minute APGAR. So it only takes really just a couple seconds to bring them out of the water up to the surface, during which they are still attached to their cord. So it's sort of happening within the context that we'd expect all babies to kind of be taking their time, adjusting to the outside world, in which they could be still getting most of what they need from the placenta and not doing a whole lot of breathing necessarily just yet. So it can be a really gentle transition for the babies, and it really is very, very low harm. Here are some of Waterbirth's benefits. As you probably can imagine, the primary benefit of Waterbirth would be pain relief. And I did, in the course of researching this presentation, come across a study that found that people actually rated the water as better than morphine. And most of us who are in this line of work would say, yeah, morphine's really not that great for labor pain. But I thought it was pretty cool that water rated higher than morphine in terms of perceived relief. And I think anyone who's currently pregnant right now, who's kind of gotten into a nice tub, has felt that kind of instant sensation of relaxing. Which, yeah, it's exactly what happens when people get in the tub during their labor. And not only are you getting the relief from the water, you actually are also avoiding the other forms of pain relief, which can be more dangerous. So epidural or opioids definitely come with their own risks. I've always actually thought that it was really unfair. Most water birth studies compare water birth to land birth as opposed to water birth to what the real alternative, mostly in the United States, is epidural birth, which can have, of course, risks. The most common of which would be a really severe headache 24 hours after the birth. It actually happens about 1 out of 100 times, which for us, we see that fairly often, fairly common complication. So I've always thought that water birth studies are kind of biased because most studies would be comparing the experimental arm to a control group, which would be an alternative form of treatment. So I would say that is one of the biggest benefits of giving birth in the water. Another major benefit would be improved mobility. You can definitely get into easier positions when you're floating in the tub, when you're feeling really big and pregnant at the end. It can definitely help you move around, which probably helps optimize the baby's position in the pelvis and might make labor faster. And some studies have actually shown that water birth can be a bit faster. Waterbirth can also help preserve your personal space, which can help aid in relaxation and kind of make it a little more of an intimate environment. And a little further down, final bullet point, it does say decreased risk of episiotomy. That's sort of one of the biggest preservations of personal space benefits that I would say comes with Waterbirth. I don't know any provider ever who's done an episiotomy underwater. So it definitely can help protect you from that kind of medical intervention. The water also provides a form of counter pressure. So if there's like this intense pressure of the baby's head coming through the pelvis, the water can provide pressure against that, which can actually feel like a huge relief. And water pressure, of course, is definitely much greater than air pressure, so it provides its own counter pressure. Effleurage is another way in which it's like a sort of delicate light touch. It kind of is another way that the nerves can be fooled and pain can feel a little bit less. So sometimes we'll use like a shower head on someone's belly for some kind of tingly sensation up at the surface. And that can actually help decrease some of the deeper pain of the contractions down below. We would consider the baby's transition to be a benefit. We think that, a water birth baby gets to kind of gently go from the inside to the outside without such a dramatic change. Of course, they can't tell us about their experiences, but we sometimes feel like we're observing them having a more calm, like unfolding experience. And then a lot of studies have shown a decreased risk of severe perineal tearing and decreased use of episiotomy with water birth. Here are some reasons that people get out of the tub. I am not quite going into risks of water birth yet, but just some times when people don't love it. I have occasionally had patients who hop in the tub and stand the whole time. They're just people who like to be moving or find that gravity is a lot more helpful than buoyancy in labor. So sometimes people just feel like it's not for them. Sometimes people find that the water is too warm. They're working really hard in labor and feeling like they're sweating, and the last thing they want to do is be in a pool. We do actually have pretty strict parameters of what the water temperature can be. That's sort of, like we said earlier, the trick that keeps the baby from breathing. So it has to be pretty close to human body temperature, about 98.6. And there may be times in labor where you're feeling really sweaty and hot, and you don't want to be in a pool of water that's body temperature. Sometimes people find water birth to be like high on the ick factor, I would say. We do a pretty good job of kind of managing body fluids so that people kind of discreetly don't notice those things, but sometimes people still find it to be sort of a little bit gross. And I've had people who are really pretty squeamish successfully have water births. It kind of takes a little bit of communication between the provider and the patient to kind of help make sure that you ideally don't see a whole lot of body fluids coming, but it can totally be done. But it's just not for everyone. And then a big common reason why people do get out of the tub would be that they find that they need something stronger for pain relief, that the tub is not strong enough. And I would still kind of consider that a successful hydrotherapy. So maybe they end up getting an epidural, but maybe the epidural happens at 6 centimeters instead of at 4 centimeters. I would consider that great, probably help the baby come down a little bit easier. So slightly less time being unable to move, slightly less time being unable to eat, being unable to pee. I think all of those are good benefits. And I would probably consider that still kind of a success. Just to add to that, we actually do get asked all the time if you can have an epidural and a water birth, and that is not an option. However, you can use a laughing gas, nitrous oxide, at the same time as you're in the water. And in some cases, IV pain medication, some providers may not all be comfortable with that, especially if you tend to respond heavily and are pretty woozy. We don't always do IV pain that's in the tub, but it can be done. And then here are some of the risks of water birth. I would personally counsel anyone who's planning a water birth that it may delay our emergency response, usually by just a minute or two, but typically in an emergency, if we needed to move to the operating room, we would just wheel your bed on in. If you're in the tub, you'd have to get out and get your way to the OR. So that is actually not something that is at all mentioned in the literature. I don't think it is associated with any increased dangers, but I sort of would talk to people about it if we're thinking about water birth. Same thing with fetal tachycardia. This is something that I have observed, and I have not actually found to be a risk in any of the research that I've read, which basically is just that the baby's heart rate goes fast, which I guess is maybe not mentioned because that's not actually in itself a bad outcome. But often I would say if the baby seems like he or she is really working hard, we maybe want to take a little break, cool them down. It's almost the same thing as if you were to have a little fever. If the baby was kind of having a rapid heart rate, sometimes heat can cause that. One of the things that the literature does mention is umbilical cord avulsion. So that's what happens if the umbilical cord breaks. So it's not cut and clamped, or it's not clamped and cut, and it breaks, and that could cause the baby to be bleeding from the cord. And that most likely happens if the cord is short and people bring the baby up really fast out of the water. I personally have never seen that, and it is such a rare thing to ever have happen, that it's actually really even hard to associate with water birth, but it is mentioned in the literature. It's so very uncommon that it's hard to find statistical significance that it is associated with water birth. It can happen on land as well, unfortunately, but really, really terribly uncommon. And then another possible risk is intraamniotic infection, so infection of the amniotic fluid. That was an association, but not necessarily a correlation, based on a water birth cohort study of that was case matched. And another sort of bunch of case reports I found showed some newborn infections from sort of water specific pathogens, so like listeria, we would think. And again, that is, those are case reports, so super, super rare, not even sort of anything approaching statistical significance. Probably, would be a good idea to make sure there's not like a water warning when you're having a water birth. And if you're having a hospital water birth, we actually take a lot of precautions to make sure that the tub is really, really clean. So we typically don't have people give birth in this tub because it is a jacuzzi. It has jets. The jets are actually removed and cleaned every single time, but we don't really tend to get any body fluids in this tub. And our actual birthing tubs are really just closed. So there's just a faucet and a drain. A lot of the water birth studies include home births, and they include both planned and accidental water births. So sometimes some of those babies may have been born in like home jacuzzis and stuff. So I'm not even sure if they should be included in these in the data. And then in terms of waterbirth contraindications, these are really, really region specific. So there are places that have really incredibly strict protocols about who can even get in the tub. You basically have to have no risk factors whatsoever. You have to be in pristine physical health, arriving on the right full moon. And there's other places that have really relaxed parameters about the tub, and some situations it can actually be dependent on the individual provider who's caring for you. So you could get one person who in your labor says it's all fine, and then the next person who comes in who says that they don't recommend it. But here's sort of what I, as a clinician, would say. I would say immobility is definitely a contraindication. That would have to do with our potential delayed emergency response. So if for whatever reason the birthing person was unable to get themselves quickly out of the water, I think that could be dangerous both for them and for the baby. And I really hate that one because I wish it was accessible to everyone, but we have not figured out a safe way to do that. Any maternal instability, so like if there's vital signs, abnormalities like severely elevated blood pressure or heart rate changes, if the mom's like for some reason losing consciousness, obviously, again, not a safe situation to be in the tub. If the baby is not seeming like they're tolerating labor well, we would generally get the birthing person out of the tub so that we could better respond in an emergency. And then all the usual kind of contraindications to vaginal birth. Typically in a hospital, you're not going to find us delivering breech babies or placenta previas or, anything like that. If we would not recommend a vaginal birth, we would not recommend getting in the tub. Certain situations where we think that you're more likely for an emergency birth, so potentially like twins or having a prior uterine scar, like a vaginal birth after a C-section. In many cases, people would say that's not a good situation for water birth. And finally, infectious disease such as HIV, hepatitis. That is really more for the baby to avoid any body fluid exposures that could potentially be hanging out a little bit longer than they would in the air because of our sort of human body temperature fluids. Also protects us as the providers. Almost inevitably, we get a little bit exposed to some water, and it helps to keep us safe. I put COVID on there as well, and with a question mark, because I think that there's probably no data on this as well. But as you've probably seen in some of the metrics, COVID is found in feces, and that's why they're always kind of testing the water supply for COVID levels. So we do think you could potentially expose the baby to COVID if the baby was born in the water. So an active COVID case, we would not recommend a water birth. And I just want to get into some of the ways that people can help themselves prepare for a water birth. Number one, really first and foremost, would be to find providers who are supportive of water birth, communicate your wishes to them, and really ensure that the other people in that group also share those practices. You don't want to be giving birth in a hospital where the birthing tub is full of dust and other medical equipment and is rarely used, or they say, oh yeah, we have a tub, and it's like maybe in a postpartum room. That does not bode well. And unless you're giving birth at home, I would recommend that you give birth somewhere with more than one tub. I think that in places where we're serious about water birth, we want to make sure that there's at least a couple options available. So if there's other people in labor, that your plan doesn't go out the window. And then just really for anyone, I would recommend optimizing health in pregnancy. So staying active, eating lots of, fruits and vegetables, sort of all the normal things that would promote a healthy vaginal birth and good mobility. Doula care can definitely help with your water birth success. Doulas tend to just help birthing people more adequately fulfill their plans and help remind us and remind you of what the plan is and what your wishes are, and also supportive partners. I guess I would say that it does require some buy-in. If the partner is kind of hesitant about water birth, that can kind of lay some seeds of doubt. So it can be a little bit more challenging, not impossible. Definitely, as the hospital staff, we definitely see it as our job, is like helping partners through labor if they're struggling with things and reassuring them as well. But it is great to have both people's buy-in regarding the birth plan. And then I definitely recommend just general forms of preparedness for natural birth. So stuff like deep breathing, hypnobirthing, visualization. Most of the time, people will not spend their whole labor in the tub. The maybe longest I've seen anyone stay in is 4 or 5 hours. That's a really, really long soak in a tub. At a certain point, people kind of get sick of not moving around, being in water, want to do something else. So definitely want to have some other forms of pain relief at your disposal, some other ways to kind of help getting through things. And then I also do recommend just kind of some movements to help optimize the baby's position in the pelvis. Ideally, we want kind of the crown of the head to be coming through. This is the smallest and easiest diameter for the baby to fit. And if they kind of just so much as sort of tilt their head this way, it can actually be a whole lot harder to give birth. So spinningbabies.com, it used to be like the go-to breech resource. They actually have a lot of great resources for all comers these days. So different exercises that just really help the baby be in a good position, head down, facing your back for like the fastest, easiest birth. And then here are some sort of recommended things to bring to a water birth. I usually tell people if you showed up off the street with only the clothes on your back, we'd have enough for you to stay for a week and you'd be totally fine, but it just wouldn't be the nicest stuff. So sometimes people who are giving birth in the tub want to wear something. A lot of people just go naked, but maybe something that you would want to get wet. We do often have partners in the tub. Sometimes that can be helpful for positioning, and we definitely prefer that partners wear something, anything. So if the partner wants to get in the tub, please have something for them to wear. And then I put towels as well. We of course have towels, but they are not the nicest and they're about yay big. So if you want to bring some home towels, that's kind of a good tip. And I would say that's probably good for anyone giving birth. The hospital towels are hospitally. And then some other stuff that you might see us using at the Waterbirth. We do use a thermometer. Like I said, we're pretty careful about water temperature. We have monitors to listen to your baby while in the tub. A Doppler we use really just for listening. Fetal telemetry monitoring can be used for longer term listening, and even can be used continuously. Those have remote monitoring, so it doesn't have any cords or wires, and it kind of goes back and we can follow the baby's heart rate. And they're totally submersible. I often use a mirror, if that helps me to be able to watch and see if the baby's close without putting my hands on someone. And it can be kind of obviously intrusive. So sometimes I can use a mirror to just kind of watch and see if the baby's coming. That's because often people in the tub are on their hands and knees as opposed to in the traditional, kind of modified lithotomy positions. I can't always guide people without being able to take a little look. And I'll usually use a mirror. Oftentimes I think people are not even aware that that is happening. And then, we often use vet gloves. I actually have one here. So it's just like an extra long glove. We use regular gloves over them so it's a lot smoother. It's kind of like a plastic bag that helps protect us from getting water. And then we do also use a little fishnet, just in case there's any solid waste. We generally remove that from the tub. If the tub gets really messy, often we just drain it and give you fresh water. So I hope that the ick factor isn't a big factor in people's decision to get out, but it's not always for everyone. Here are, from the research, some of the factors associated with successful water birth. So multiparity, so basically people who have given birth before are more likely to successfully have a water birth. And I guess what I would say for that would be, if it doesn't work the first time, come try again. And I also wouldn't necessarily consider not actually having your baby in the water to be unsuccessful. I would consider even just waiting a little bit longer before getting an epidural to be a successful use of water in labor. Other factors, spontaneous labor. So if you can avoid getting induced for unnecessary reasons, that's great. Not everyone can successfully do that. For a lot of, if you're getting midwifery care, we'll often recommend sort of a lot of techniques in late pregnancy to just help with spontaneous labor, really gentle, mild stuff that's safe, that can just kind of help prime your body. That usually start people with 36 weeks. And then a supportive experience provider is also associated with successful water birth. So I wouldn't recommend attempting a water birth if you are going to be that provider's first water birth. It wouldn't be anyone's first anything, really. And then in general, at least in our hospital, we would say that people are still welcome to have a water birth if they need IV fluids or medication. So if you have an IV, we typically just cover it up with a glove or a plastic bag. And the fluids or medications can still be given through the IV. That's absolutely not a contraindication. If the baby needs to be continuously monitoring, so maybe we are inducing you, maybe the baby is sort of not for certain 100% well, we have monitors that can absolutely go into the tub. So that is not a reason to not have a water birth. Like I said, you can have a water birth if you need to be induced. And then at Pioneer Women's, we would say if there's a pretty wide range of high-risk pregnancy. So oftentimes people are told that they're having a high-risk pregnancy at the very beginning of pregnancy, and it has absolutely nothing to do with what you would expect at the birth. Maybe there were issues with fertility and then you got pregnant. In cases of like increased BMI, some autoimmune diseases, there's an advanced maternal age even. There's a lot of sort of labels of high-risk pregnancy that would totally be fine to have water birth. And even certain other ones in sort of individualized situations we would support. So certain like well-controlled high blood pressure or even gestational diabetes that's well-controlled, sometimes even VBACs, depending on the situation. That's a vaginal birth after C-section that can perhaps safely have water birth. Definitely those ones depend more on the provider, but I guess I would not say that it's exclusive to low-risk pregnancy at all. And then in terms of what to expect, what your baby might look like upon emerging, I did find some data to suggest an aqua apgar, which is basically like that the baby may not cry right away, that they're just gently, slowly unfolding. They're alert, their eyes are open, and they're not necessarily crying. And I do often kind of warn people about that. I would say your baby may be quiet but healthy. And we get some babies who just vigorously cry, but it's kind of common that you may not get a really, really loud cry, but the baby is breathing and just kind of gently unfolding. However, the research did show that the 1 minute apgar greater than 7 is actually more common among water birth babies. And I don't totally know if that is sort of done with an intention to treat study. So it's possible that they're just getting any babies that are potentially in trouble out of the tub, which would be good clinical decision making. But in general, water birth was associated with higher 1 minute apgars, or greater than 7 1 minute apgars. And then what happens after the water birth? Usually there's some time, if everyone's well, to kind of pause, relax, and bond with the baby. Typically, if the baby is looking fairly well, we just perform the initial assessment in the birthing person's chest or lap. We do really try and pay attention to newborn temperature. So the baby should either be warm and dry or warm and wet. So if there's cold water in the baby, we'll try and replace that with warm water. Sometimes you'll see us kind of gently pouring cups of water over the baby's shoulders to make sure that the water is warm on their bodies and they're not getting cold. Birth of the placenta, of course, has to happen, which is always such a downer. You just push the baby out and you're like, oh, right, the placenta. And I would kind of caution people giving birth in the tub that bleeding often looks way worse in water. I think anyone who's ever had a period over a toilet kind of knows that. So if you don't like to see your own blood, there's often ways that providers can manage this for you. Sometimes we just get out of the tub to birth the placenta. Sometimes if people are just like not ready to move yet, we'll wrap some warm blankets around you, drain the water to sort of lower and let the placenta come out into the air. And there's people who don't mind that at all, and it is quite safe to deliver the placenta in the tub as well. But maybe it looks a little worse than it would in the bed when the bleeding doesn't tend to spread quite so far. So that's definitely something to bring up if you tend to be a little bit squeamish about seeing your own blood. And then we do transition to a bed to take a look, see if we need any stitches or manage any bleeding. So we don't usually hang out in the tub for a long time after the birth, but hopefully for a little while so that you can kind of enjoy gazing at your baby and not be on the move really quickly. And then long-term benefits of water birth definitely associated with increased maternal satisfaction of the birth experience. I found it interesting when they asked people in labor if they were having pain, they found that people in the water rated their pain just as high as people who were laboring on land. However, afterwards, when they asked about the pain, the people reported that their birth was less painful. So I think that there may be some hormones at play and just some sort of powerful sense of positivity about water birth, and that helps people forget some of the pain of labor and increases some of the satisfaction. In terms of the infants, no major long-term differences. This picture is one of my water birth babies, who to this day cannot have water even near her eyes. She doesn't actually like to be submerged at all. She's okay with a bath, but definitely no major difference from my land birth baby. So hates even a little drop of water in her eye. Not a swimmer. So yeah, I think great. We have some time for some questions. I hope to hear from you. Sorry if this was fast, but thank you.
Well done, Sarit. I loved your presentation. You really covered a lot of questions I actually had for it. So thank you for doing that. Really terrific talk. And as Sarit mentioned, we'll open up for Q&A. You can type your questions in the Q&A box, and she'll gladly answer your questions. And it looks like we have one already. The primary benefits of water birth appear to be for the birthing individual, not the baby. Yes? Agree with that statement?
Yeah, I would actually say that I agree. I think it's definitely hard to understand what the baby's experience of birth is. Thank God, probably, because if we knew about it, I mean, they'd probably be saying that their heads were squeezed and that it was really like dramatic for them. So yeah, I think, like we said, there's maybe some benefit in terms of the Apgar, and certainly some benefit in terms of avoiding other forms of pain medication that could be dangerous to the baby, such as opioids, can decrease the baby's respirations. But in terms of like statistically significant benefits, they're not really able to identify anything. I think if you were somehow able to interview the babies, they'd be like, yeah, water birth was better for me. But yeah, we don't really know of any like long-term benefits for babies.
Thank you. Next question. What is the typical time spent in the tub? Is there a typical sequence for the birth?
So I often strategically will encourage people who are planning a water birth to hold out as long as they possibly can before getting in the tub. Mostly because if that is your big plan and then labor takes longer than you want to hang out for in the tub, it can feel really hard. Like, what am I going to do next? I was in the tub, I'm sick of the tub. And then that often kind of leads people to more medications. So usually I would say, do as much as you can and wait until it's completely unbearable and then get in the tub. And it really depends on the labor in terms of time frames. So we get labors that are sometimes a couple days that can be totally normal and can result in a successful water birth. And sometimes people getting in and out of the tub a couple times in their labor, totally fine. But generally, if we know water birth is planned, we think someone is getting close to pushing, we'll get the tub started because it does actually take a while to fill. They're pretty deep. And definitely, if we're getting close to pushing, try and help people get into the tub at that phase. But really, I tell people there's no centimeter dilation that you're required to be in to get in the tub, and that's actually kind of different from other practices. I would say sometimes people say you should really be in active labor before you get in the tub. Sometimes people say the water can slow things down a little bit if it's not super active, and I have sometimes seen that. But I think if you are starting to contemplate maybe getting something stronger for pain relief, I would get in there because, I would rather go from sort of the gentlest technique to the more medical later. I hope that sort of answered the question. Maybe you were asking more specifically something else.
Well, thank you for that. That was excellent. We encourage you to, change up your question a little bit if you need more details. Kathy has the next question. What temp do you keep the water in the tub?
We aim for 98 degrees-ish. It can be plus or minus a couple degrees. So obviously our tubs are not continuously heated. So they do kind of slowly cool with time. So often we'll actually start with a little bit hotter and sort of let them come down. We'll add some hot water. It should be pretty close to body temperature. We do check them with a thermometer, but there's a really easy way to check the tub temperature. It's kind of like if you close your eyes and put your hand in, can't tell where the water starts. That's perfect. That the baby should not be able to tell where the water starts.
Wow, interesting. Thank you.
Yeah.
Next question, APGAR. They're a little confused about that, and they want to know if the number 7 is a good number.
Oh, yeah, absolutely. Sorry. So the APGAR score is this assessment of newborn well-being that's been around for kind of like, I think over 100 years. So they look at the baby's heart rate, breathing, color, tone, and reflexes. So like they're sneezing, and they kind of grade the baby. And so the highest score you could get would be a 10. The lowest would be a 0. That would be basically if the baby was not alive. So at APGAR, greater than 7 is considered good. Most a super vigorous baby would get about a 9, but it's generally considered well-being if you're getting over a 7. Yeah.
Great. Thank you. Good info. Kelsey would like to know, do all insurance plans cover Waterbirth? And how would someone know if they are eligible or not?
That is such a great question. Waterbirth is not any extra charge. It's, if anything, a lot cheaper than anything else. So it's free, really. We don't bill separately for Waterbirth. It doesn't sort of make it onto insurance. Yeah. So you are eligible from an insurance standpoint. Obviously, we'd have to go over your individual stuff if you would be eligible from a medical standpoint. But yeah, absolutely. It's a really like low cost form of pain relief.
Thank you. Just another question on that. So if somebody was interested in a Waterbirth, and clearly Baystate Franklin has Waterbirth, would their OBGYN, would they check with them to make sure that they're okay with Waterbirth, or is it available to everyone?
It's in our hospital, it is. And I can't say the same elsewhere. I think most home birth midwives, yes. And a lot of hospitals, no. I think that may not always be the case. But you would definitely want to talk to your OB. And I mean, in general, I would say that OB should be asking you your birthing preferences and what your plans are and your wishes are for your birth. So hopefully that's part of the conversation that you're having in your prenatal care, especially if you're getting into the 3rd trimester. If you're seeing us, we'll usually put some little notes in that say, oh, this person wants this and not that. So we kind of get things ready to go. And are prepared for when someone comes in labor. And actually, usually I warn our patients that if they are planning a Waterbirth, we do a really careful job of trying to make sure a tub is available. And so sometimes that does mean getting checked out in a room that doesn't have a tub. And so we kind of are timing things. So you might kind of, if you're not totally sure you're in labor or not totally sure you broke your water, sometimes we'll check that stuff out. And then once things are moving along a little bit more, get you into a tub then. And also sometimes move people out of a Waterbirth room once they've recovered that the room is available. So up here we have 3. And I don't think I've ever really been in a situation where we were really stuck and didn't have at least a tub to offer people. This being our backup room where we don't usually deliver babies, but people can get in and be submerged into the water. We don't have all of the equipment for resuscitation in here, but in a pinch, it can be done. We try to avoid that.
Excellent. Thank you. Amanda has a question. If an OB isn't supportive, how easy is it to get in for a Waterbirth with you?
Really pretty easy. We take people up until they're pushing, I guess. We're pretty open and flexible. Yeah. We're, yeah. And we do take a lot of people from really all over the region for Waterbirth who transfer in for us. And I would kind of realistically say a big chunk of them don't necessarily have water births. A lot of them do. And actually, we've had some great success lately where people are like, I'm coming for a water birth. And we're like, okay, we hope it happens. And then they do. And it's just the best thing on earth, especially if we've had people drive from like 2 hours away. We're like, we really better make this happen. So yeah, but I like I said, I would seek out water birth even if I knew there was no chance my baby was coming out vaginally, because I really think that it kind of is a good marker for the overall experience. There's other stuff that we're doing that water birth it's just kind of like it's just like a way that things can be individualized. So even a C-section can be individualized. If the baby comes out with us for a C-section, we have like a lot of different options that we offer people. We offer like clear drapes to help people watch their baby be born. We have partners cut the cord. We have like low lights, play music, try and kind of carry this mentality into really everything that we do.
Oh, that's so wonderful. Thank you for your passion with that too. Let's see. Kathy has a question. Two questions. First, how many water births do you have each year at Franklin? And any possibility that Baystate Medical Center main campus would ever offer water births?
I think that they are moving towards it. I think they do have a tub and sort of need to get the ball rolling. And I actually would really empower you as a consumer to ask for it, because believe it or not, that is hugely powerful. We are always listening. Every survey that comes back, we are like going through with a fine-tooth comb. So if they were to ever offer it, I do think it would come from patients. So I really advocate for you to ask and to kind of urge your provider to kind of make that happen and to sort of be the voice that brings them. Because I do think that they have a tub and I don't think it's in use. But there's no real reason. I think that there's tons of really wonderful midwives there that would love to do it. And I think it's kind of just takes a lot of voices and kind of getting the ball rolling to make it happen. But once you get started, it's like not a big deal. They're so easy and fun. And I don't know, it's like it's great for us too. I mean, not everything that we do every day has to look the same way. I mean, we have gorgeous water births that we're thrilled to have, but we also like people like give birth crouching on the floor next to the tub. So I think it's there definitely can be some support. Actually, when I originally signed up for this talk, I totally misinterpreted what it was. And I thought I was going to talk to providers about water birth. And I was like, yes, we're going to bring it. So I encourage you to ask for it. I think that that is probably the way that it would happen. And there's definitely other places in the Valley where you can have water birth. I know that the birth center in Northampton is doing them, and certainly home birth midwives are doing them. I know Cooley labors people in the tubs. I don't know that they deliver people in the tubs. I think that the way it happens is from listening to people ask for them. And I actually don't know our statistics on water birth. It feels like it's like fits and starts. We actually did a lot fewer in COVID. We're just like super cautious about any possible transmission. We didn't have a great understanding of how COVID could be spread. We didn't have testing for a really long time. So our numbers went way down for a while. And I think also we were doing, unfortunately, less labor support. Everyone was sort of scared to breathe on patients. We were afraid we were going to get them sick. So we were not even as hands-on. And we're now getting another, like a bit of an upswing. We're kind of coming back and being like, okay, we've got good testing. We've got good PPE. We can like be present in the birth room and just kind of be hanging out, being supportive. During COVID, unfortunately, we really are not doing a lot of water births for a while, but they're definitely increasing now.
Wonderful. Thank you. If we'll just give it another minute or so, we're just about at time anyway, in case there's any more questions. I just wanted, Amanda says, thank you very much. Very informative. And I would have to agree with her.
Thank you. It was really fun to get to talk about this. And thank you so much for all your questions. And sorry I didn't get to show you a real tub birth room. This is, like I said, just our little jacuzzi room here. Like I said, we really try to avoid having babies in here because we don't have all the emergency equipment. Most of the time it looks a little bit more like a birthing room, but it's such a nice option, and the jets are good. Like I said, we don't have jets for birth, but it's really great for labor.
Well, thank you again, Sarit. Have a great night. And
thanks, guys. Thanks for helping with
Thank you for your time and expertise. And thanks for all of our attendees for joining us tonight.
Take care.